Hi, I'm Dr. IJ Eco, and I'm a fertility specialist at Pinnacle Fertility of Illinois. A question that patients often will ask me who are interested in egg freezing is, how many eggs is enough? And the reality is there's no perfect number. If you are starting the process between 25 to 35, you'll need fewer eggs, and so that's why I often encourage patients to really think about doing egg freezing younger if they are potentially going to delay their family building age. So between the age of 25 to 35, if you were to say get 20 eggs, which is a lot, but let's say you got that magical unicorn 20 eggs, that would probably give you about a 90% chance of having one child from that number and about a 65% chance of having 2 kids. If you're older, it's going to mean freezing more eggs. I would encourage patients who have frozen their eggs to think about the egg freezing as a backup plan, not an insurance plan, because if you are still within a reasonable age, try to get pregnant on your own. Meet with a fertility provider, review your history, and see if it makes sense to try on your own before jumping to thawing your eggs and fertilizing them. Another question that I often get is, okay, can we test the eggs? I want to test the genetics of the egg. And unfortunately, we just don't know how to do that. We can test the genetics of an embryo, which is an egg plus sperm combination. But for eggs, the genetic quality of the eggs is going to be associated with the age of the person who's giving the egg. So again, usually younger is better. So upper 20s is kind of like the best it ever gets. And then lower 30s, mid 30s, still ideal. And then as we age, then opportunity for an egg to yield a genetically normal embryo is going to decrease. So if you have more questions, I would encourage you to schedule an appointment with a fertility provider. The internet has a lot of good information, but also has a lot of scary and incorrect information. Hope that was helpful. Bye.